Hi guys, today's video is about knee bursitis. Let me give you a fact about what is a bursitis. A bursitis, think of it as a pillow with synovial fluid inside that is around joints that helps basically reduce friction, as the muscles and tendons, go over the bone. So that's pretty much what is a bursitis. So a few bursitis, we're gonna look at the knee. We're gonna look at the suprapatellar bursitis, which is above the patella, where the quadriceps tendon is at. The prepatellar bursitis, which is the bursitis at the front of the patella, so the very front of the patella. The deep infrapatellar, so it's a infrapatellar or bursitis that is deep behind the patella tendon, and we have the superficial infrapatellar bursitis, which is the one in front of the patella tendon. So don't get that mixed up. Pes anserinus bursitis, so it's a bursitis around the medial knee. The IT band, which is on the lateral knee, so it's a IT band syndrome. And you have Baker's cyst, which is at the very posterior side of the knee. So it's not back here, but I'm going to show you later. So let's move on. So we're gonna first look at prepatellar bursitis. So what is prepatellar bursitis? Now, prepatellar bursitis is also known as housemaid's knee. So it's an inflammation of the bursitis around the kneecap. So it causes, similar symptoms like swelling, tenderness, pain, caused by often prolonged kneeling, such as cleaning, carpet lifting, or gardening, or even from direct impact from sports or injury, so like a clash in injuries. Now, to help reduce inflammation of the bursitis, right, what we can do is we can involve treatments such as RICE. So RICE is rest, ice, compress, and evaluate. You also wear some knee pads and medications as well. Now, sometimes steroid injections may be injected into the bursitis to help reduce the inflation even more, or draining of fluids as well. So, but if you do notice there is symptoms such as swelling, redness of the bursitis, or like redness of the knee, or uh, a warmth, right, can indicate a suspicion of fever, so that needs medical attention otherwise. So this is housemaid's knee. Next, we have infrapatellar bursitis. Now, infrapatellar bursitis is also an inflammation of the bursitis, but it's actually near the kneecap, so just right below the kneecap. It's often caused due to repetitive kneeling, such as praying, working on hard surfaces, direct trauma, or squatting a lot. Now, this can actually lead to a bunch of pain, swelling, redness, tenderness, stability problems with extending and flexing the knee. Treatments otherwise are pretty much similar as well, such as rest, ice, compress, evaluate. Can also use anti-inflammation medication such as ibuprofen. I mean, you also may need antibiotics if it's infected, such as symptoms such as fever, redness, and warmth of the knee. So this is infrapatellar bursitis. Now, one thing to note is that infrapatellar bursitis is the one in front of the patella tendon. The next one I'm going to look at is the deep infrapatellar bursitis. So this is the one behind the patella tendon. Same thing, it's an inflammation of the bursitis just below the kneecap, behind the patella tendon. It's often overuse it's often caused due to trauma or overuse, like kneeling, which causes pain, swelling under the tendon. Sometimes, fun fact, it can be linked to patellar tendinopathy. So treatments otherwise is quite similar as well. Rest, ice, compress, evaluate. We can use physiotherapy as an alternative. Now, in severe cases of but the bursitis being quite inflamed and there's a lot of buildup of fluids, what we can use is a clinical procedure called aspiration. So aspiration is actually the drainage of fluids, and if not, we also can inject steroid injections as well. So this is deep infrapatellar bursitis. Next, we have suprapatellar So same thing, it's an inflammation of the bursitis, but this time it's located above the knee, so where the quadriceps tendon would be at. Now, this bursitis actually allows the quadriceps tendon to reduce friction as the tendon glides over the bone. Now, symptoms include pain, tenderness, swelling, stiffness, redness, sometimes having trouble extending the knee a lot of times, because if you do know, the quadriceps muscles is the key muscles for extending the knee. Now, causes include of the inflammation otherwise could be due to overuse, repetitive movement like squatting or kneeling, direct impact to the hip or blow to the knee. Now, it also can be caused by some underlying conditions such as gout, osteoarthritis, or rheumatoid arthritis as well. Treatments otherwise are quite similar. Rest method, you can also take over-the-counter pain medications if needed, and you can have a knee wrap or knee sleeves as well to support the knee even more. So this is pre-patellar bursitis. So suprapatellar bursitis, my bad. It's the very top part of the knee, so around the quadriceps tendon area. Just remember. Next, we have the pes anserinus bursitis. Now, the pes anserinus bursitis is located around the midline, so close to the medial side of the knee, alright? Now, it's actually just located below the joint line where the tibia and the three hamstring tendons include. So we have the sartorius, the gracilis, and the semitendinosus. Those tendons actually insert at the pes anserinus bursi right there. Now, this is actually inflammation. So when it gets inflamed, right, it actually can be caused due to overuse or repetitive movement, such as common in sports. It's more common in sports. Sorry. Also can be caused by improper exercise technique or tight hamstrings muscles, abnormal knee alignment, obesity, or knee osteoarthritis as well. Now, treatments otherwise will include the RICE method, and long-term medications and preventions include physiotherapy, stretching, weight management, and over-the-counter pain medications as well. So this is pes anserinus bursitis. Is located around the medial side of the knee. So if people come in with knee pain on the medial side, you can think of the pes anserinus bursitis. Next, we have IT band syndrome. So IT band syndrome is actually an overuse injury that is causes pain outside of the knee, so more on the lateral side. It's often more commonly experienced by athletes such as runners and cyclists. For this, IT band syndrome is actually a treatable condition that responds well to non-surgical methods. But symptoms may include sharp pain, dull aches, burning sensation, clicking and popping sounds, instability, sometimes having trouble bending and flexing the knee because of the pain. It's caused by weak hips, specifically the gluteus medialis muscle, so the adductor muscles, and poor biomechanics such as a flat arch or flat feet and improper footwear. So, or you could have due to alignment issues of the bones, such as the femur or tibia. Now, treatments and managements, rest and activity modifications. So you got to actually adjust your activity modifications. RICE method, rest, ice, compress, evaluate. Physical therapies, like physiotherapies to strengthen the gluteus medialis muscle. You also can take non-steroid anti-inflammation drugs such as ibuprofen or paracetamol to reduce that inflammation even more. So for IT band, I would consider it as a overuse injury. Now, this can be managed with physiotherapy and strengthening to eventually get better. And lastly, we have Baker's cyst. Now, Baker's cyst is a bursitis that's located at the back of the knee. It's often inflamed. It's often painless, but you can feel a bulge at the back of the knee. Now, how Baker's cyst develops is when excessive synovial fluid from the knee joint, right, builds up and then just kind of pushes that synovial fluid at the back of the knee, creating like a bulge, so like a bump there at the back of the knee. Also can be caused by some underlying conditions such as osteoarthritis, rheumatoid arthritis, or gout, particularly more common within the older ages of 40 or 50 years old. Now, for Baker's cyst, right, symptoms may go unnoticed. Why? Is actually because it's just an inflammation of synovial fluid, so an excessive buildup of it. Now, when those symptoms occur, right, they're usually typically mid, so you usually feel like a dull ache sometimes, some stiffness, some tightness, or just aching at the back of the knee, sometimes a bit of difficulty bending or straightening the knee, but overall, it's really just typical symptoms, just mild symptoms. Now, for treating Baker's cyst, right, treatments include the RICE method, physical therapists. You can take non-steroid anti-inflammation drugs such as ibuprofen and other medical procedures such as aspiration if needed to drain the fluids out. So that is some of the common bursitis of the knee. So a recap of it, we have the suprapatellar bursitis, prepatellar bursitis, deep infrapatellar bursitis, superficial infrapatellar bursitis, pes anserinatus bursitis, IT band, and Baker's cyst. Thank you for watching.